Hello, America. It's day 14 of the Great Quarantine of 2020. We find ourselves with literally nothing to do. I am sitting in an empty office. Sad. I miss my patients. Having said that, like many of you, I'm trying to come up with ways to benefit myself, benefit society in this weird time where we're all sort of in timeout, in suspended animation. So I've been making these videos about a variety of things, and I've decided today we're going to discuss a nutritional supplement, and this is going to sound hokey because I'm a pretty scientific person, and you're going to think that now I am drinking the Kool-Aid and have gone wackadoodles, but there's true science here. So, and I am no expert by any means. However, I'm a firm believer, and so I thought I would share with you, regale with you my knowledge of CBD oil in particular. What is it? Why do you need it? How does it work? And what could possibly go wrong? Now, I was told, I've had a fair number of people watch some of my videos. You people are bored? Whew. Anyway, there's some of you out there in TV land have decided that I am entertaining, and I don't know why, but I have been told that I'm much more entertaining when I keep a calm and soothing voice. I guess I calm the animals somehow. I'm like the Pied Piper. So I'm using my calm, soothing indoor voice. In particular, a shout out to Jared G in YouTube world. I don't know who you are, but for you, I will not raise my voice, and I will speak as calm and soothing as possible, which is why I think the CBD oil is the perfect topic of discussion, since I'm going to be as calm as possible during this video. Now, what is CBD oil? So CBD stands for cannabinoid. It's a molecule that frankly is in most living objects. So it gets its name from cannabis plants. That's what they studied, and cannabis plants have a huge variety, probably the most complete source of these molecules, but you'll find these molecules in all kinds of plant and animal life. In fact, your body is lined with receptors for 400 or 500 different cannabinoid molecules, and so it's an important thing for our bodies to have. About, I don't know, maybe 60 years ago, people decided in the whole reefer madness days that a hemp plant looked too much like a pot plant. And so both plants were banned in America. Now, I am no conspiracy theorist, but in that same period of time where we've not had access to high doses of cannabinoid molecules, the incidence of inflammatory diseases has really skyrocketed. And one of those diseases includes obesity, atherosclerotic disease, arthritis, autoimmune diseases. And so is there a correlation? I don't know. It may be true, unrelated kind of an issue, but for certain, we as a society are walking around with a deficit of cannabinoids in our diet. And so recently, Americans have lifted this ban, in particular the federal government has lifted the ban on hemp sources of cannabinoids. It is interesting, when I opened my spa and I was going to sell CBD oil, because I truly believe it helps people, I couldn't get anyone to insure the space. I could not get a credit card processing company to agree to process credit cards for us. And I'm a medical doctor, and this is a medical office. But because I disclosed the CBD thing, it became a banking issue. And I'm not 100% sure why. The source of CBD oil that I use is actually out of Brazil. So the Brazilians, like the Europeans, have been using CBD on a medical front for many years. It's part of their medical treatments because it has a known anti-inflammatory response. The FDA has recently approved one CBD product for inflammation. We happen to sell it. I'll show it to you. It's this thing. It is a combination of highly purified hemp CBD oil and turmeric. It's extremely effective for inflammation. So if you've got arthritis or some sort of thing, you want to stay away from narcotic pain medicines, CBD is actually a good way to do that. In recent times, the FDA is also coming down rather hard on doctors, and in particular, it negatively impacts me as a surgeon because they don't want us writing for any narcotics, and they would like us to do surgeries without narcotics. And that is a hard sell, I will have to admit. There's a lot of patients that aren't jiggy with that idea. So I believe I'm going to be using a lot of CBD products to augment my post-operative pain control. And I think it will be a good thing. I am working right now with a compounding pharmacist to try to create a few Dr. Toker post-operative formulas that will help on that front. Okay, so what is CBD? Okay, it is a naturally occurring molecule that seems to help with inflammation. There are two types of CBD molecules. Those that are peripherally acting in your body for inflammation, that's what I'm talking about. And then there are molecules that cross the blood-brain barrier and have a neurologic change to the person who takes it, and that's what THC is, and that's made by a marijuana plant. So THC is still considered illegal in this country. These molecules work in balance. If you watch any nature, look at the human body or anything in nature, it is balance that is a calling card of God, right? Things must be in balance in your life. You must have balance. And these molecules need to be in balance. Too much of one or the other will throw this balance off. The modern forms of marijuana plants have an extremely high concentration of THC. It's one of the reasons I think we really should control it more tightly. High doses of THC will throw your body out of balance and increase your inflammatory response. As a colorectal surgeon, I will see patients with nondescript abdominal pain fairly frequently, and it's related to too much marijuana use, believe it or not. And I know all you guys out there like, oh, this stuff is awesome. Okay, but I will tell you marijuana is not good for you. Okay, so put down, the wacky tobacco. Anywho's, but you do want to have balance in your life, and naturally occurring CBD molecules will help put your body back in balance, but modern created marijuana products will throw your body out of balance. Does that help? That's the way I would like to look at it. Okay, so that's a very rough guesstimate on what CBD molecules are. It can be very confusing for the average person to figure out how to purchase the stuff. If you've ever been in a CBD store, you will see this stuff as liquid tinctures. You'll see it as capsules. You'll see it as ointments, as roll-on things, as vaping cartridges. So, how do you dose this stuff? And also, when you try to price compare, that's the other thing. Some people will try to price compare and think, oh, well, this one is cheaper than the other one, so I'll get it because we're good consumers in that way to try to save our money. The reality is this. These products all pretty much cost the same per milligram of CBD. Okay, so I have before me. So we've got this one is FDA approved. This is extremely purified CBD, and each one of these capsules contains 25 milligrams of CBD oil and then a certain amount of turmeric, 200 milligrams of turmeric. Okay, so the price of this is based on 25 milligrams per capsule, and this container has 30 capsules. So it's a 1 month supply. Okay. Compare that to this. This is a tincture, and this actually has 0 THC in it. The CBD in this is from non-hemp derived plants. There's no cannabis involved in a hemp plant or elsewise in this. So there's 0 chance that you would have a positive pot test using this. However, this entire container has 200 milligrams of CBD oil. So that's the equivalent of 8 capsules of this one. So 8 capsules of this equals this entire bottle. Okay, so this entire bottle is probably 1/4 or 1/5 the cost of this entire bucket. Why? Because of the amount of CBD you're getting. Okay? The advantage of the liquids, not only is this an advantage because of the THC issue, if you're someone who is in a field that gets tested for THC, you'll not want to do some of these hemp-derived CBD products because there is some debate as to whether or not that will cause a drug test to be positive. If you cannot take the chance your drug test is positive, you'll want to use a non-hemp derived CBD. The other advantage of the liquid tincture is that you can dose yourself according to your personal needs. Now, one of the reasons the FDA has not approved a lot of these CBD molecules is because it's very difficult to dose. Every individual is balanced differently and requires a different amount of this substance. And if you don't know, one of the easiest ways to figure that out is with a liquid tincture. You might want to do 5 milligrams a day for the next couple of weeks. Did that fix your symptoms or not? If not, double the dose. Double the dose every 2 weeks until it improves your symptoms to your liking, and that might be your dose. That may also wind up being a lot of this liquid, and you might think it's easier to take a pill, in which case you can take a capsule. Now, this company I like because they also do a digestive. It comes with some herbs and some probiotics, some enzymes. They do a sleep one that mixes some herbal supplements and melatonin in with the CBD. So that's a pretty popular one. And they do one for immunity, which includes some echinacea and some vitamin C with your CBD. And again, it's based on the concept that we want to calm down your inflammation and also give you some other herbal supplements at the same time. So the dose of CBD that you need is highly individualized. Your response to the CBD is highly individualized. And so it's not a miracle drug. You might find that it doesn't help you sleep, but that it helps your arthritis. I personally get energy from taking CBD oil. I know that seems strange. I am built a little bit like an Energizer bunny. Stuff gives me energy. But so high doses of CBD oil give me energy. Low doses of CBD oil might actually make me a little sleepy. So I'll take a low dose at night if I can't sleep. But in the morning, if I have a long day, you give me a high dose of CBD oil and a little bit of caffeine, dude, I work all day. Not a problem. Anyway, so that's kind of how it works. Okay, what else am I missing? Oh, what could possibly go wrong? I alluded to what could go wrong. First of all, you could have a positive THC marijuana test if you do high doses of CBD oil. And that is because a lot of CBD oil companies get their CBD from marijuana plants. High caution on those. The stuff we sell here comes from hemp plants. So it's more of a nutritional supplement. It's not sold as a CBD oil. It's sold as a hemp supplement. And so those hemp plants have 0% THC. I am still supposed to warn people it may cause some pot-related drug tests to be positive. And so in patients who are firemen or pilots or physicians or nurses, then we suggest the 0 THC chance tinctures, just for the FYIs. The other thing that could possibly go wrong is if you take too much, you will throw yourself out of balance. And if you are out of balance, you might increase your anxiety, not lessen it. You might increase your inflammation, not lessen it. So, Americans like more, they like more bang for their buck. But in this instance, balance. You want it's like cooking. It's like using salt in your food. Just enough. That's what you need. Just enough. Okay? So CBD oil is the same way. Alrighty then. I think we covered it. Okay, everyone, enjoy your quarantine, right? Do everything in moderation. Try to better yourself. And I look forward to seeing live human beings back in my office sometime really soon. And anyway, to you, Jared G. I don't know who you are, but I'm hoping I used my inside voice better for you. We'll see you guys on the flip side.